Hello, everyone, and thanks for joining today's webinar, the COVID impact on healthcare costs, where we're going to compare the Biden and Trump plans for reducing healthcare costs. My name is Mike Vanoy. I'm the head of marketing at Assure, and I want to thank you for joining me in today's important topic. Also, I want to welcome our guest today, Nellie Mulrooney. She's an MBA out of Chicago. She's with the firm Assurance, which is a Marsh & McLellan agency. And very steeped in this information. Welcome, Nellie. Look forward to a very informative conversation.
Thank you, Mike.
Okay, so I think I want to spend most of the time today breaking down the differences in the Biden versus Trump plan. And I just want to be clear, I'll probably say this several times. This is definitely not a political conversation. We're not going to advocate for or against either candidate. We only advocate for one group, that's small businesses. We want small businesses to succeed and to grow. That's what our mission is all about. And in 2020, I think that's more about survival and compliance and figuring out how to plan to grow once we get out of this mess that this pandemic and how it's impacting all of our businesses. But part of that is we want everybody to be as informed as possible. So this isn't to necessarily educate you how to vote. If it helps you, great. But this is more importantly, this is to help small business owners, executives at mid-sized companies, entrepreneurs, to help people budget and plan and to think about the future for what is likely one of the biggest expenses in most businesses, which is healthcare costs and benefit plans. So with that context, before we start breaking apart what we've kind of broken into the top 5 categories, I'd say the differences between the two camps and their plans. I think we just need to have an initial conversation, Nellie, about how 2020, how specifically how the pandemic is going to impact premiums, right?
Sure.
It's pretty funky. It's a healthcare crisis, but in some weird ways, some costs are going down in the short term. Some are obviously going to go up. What would you say? Let's just jump in and kind of break this apart. About what do you think the factors impacting all these like delayed medical treatments and shutdowns and short-term savings versus long-term expense? How do you think this is going to flesh out for 2021?
Sure. And Mike, although it is still early at this point to project the overall financial impact of the COVID-19 pandemic on the insurance industry, the postponement we've seen of elective surgeries and other non-emergency medical procedures have absolutely contributed and will continue to contribute to healthcare costs as we continue to move forward.
So let's just talk about maybe just the delayed treatments. So this is a big one, right? What is it? How do you think all of these delayed treatments? The person who didn't get the high blood pressure checked and didn't realize they had a problem until they're pretty far along. Maybe they're terrible situation. Instead of catching a stage 1 cancer, that's stage 3 or 4 before it's caught. What do you think the impacts are going to be?
Sure, absolutely. So actually, we follow regularly a variety of different data sources, and one that's really interesting was a recent survey released from Covered California, which is the state of California's Affordable Care Act marketplace. And through this survey, it's showing that an estimation that plans in 2021 will likely be priced not only to cover any kind of unexpected losses that they've had, but also to cover anticipated costs for next year as well, which is, to your point, Mike, inclusive of these non-immediate care or postponed services that we've been talking about. And so in this report, as well as several others that were released by the Kaiser Family Foundation, it is estimating that without any federal intervention, that costs could prompt commercial healthcare insurers to increase premiums from really anywhere to 4 or 25% as kind of a rough ballpark for 2021 or even 2022, depending on the rate of normalization back into medical plan utilization. And it's important to note, though, that when we think about healthcare costs and increases, that those increases will absolutely vary depending on employer. And so policies through commercial health insurers are underwritten to consider a variety of different risk factors, such as claims experience, member demographics, market trend, those types of things. And so considering that, any kind of blanket statement of, exactly what the increase will be is hard to determine and not possible to fully identify, but we can roughly estimate at this point based on some of the data we're seeing in these studies through all of different reputable sources, and we can therefore have a relatively good gauge. And on a client specific level, we do have the capacity to focus that even more, assuming that we can dig into some of that claims data and get more information.
Now, as I've talked to some small business owners who are self-insured, they're
Hmm.
expecting some good guys, if you will, to the budget, because for
Hmm.
2020 the claims are down just simply
Yes,
because you got shutdowns, right? And sometimes services couldn't be performed.
right.
Others maybe they could, but people didn't feel comfortable, and for any number of reasons were delayed, right?
Yes.
What about those who are not self-insured? In presumably there's tremendous savings by the carriers in the 2020 plan. Will those savings kind of be rolled into their thought process for 2021 and create some offsets, or is it kind of a roll of the dice and it's really just 2021 will be priced based on what expected cost will be?
That's a great question. And at this point, it's still a little too early to tell as far as how each insurance carrier will handle that, because to your point, Mike, the utilization has absolutely been down in 2020, just due to the pandemic. And from my lens in advising and guiding our clients and employers, specific in employee benefits, a real key component of preparedness. So, regardless of a pandemic, but of course, considering that we are in one, to focus on that, the biggest thing we can do is really to obtain and track monthly medical claims data from their respective insurance carriers, both specific to COVID-19 claims. If we can get that, in certain situations, depending on size, it might not be available, but if we can get that COVID-19 claims data as well as overall claims data, then we can ultimately review with our clients, and that gives us detailed insight as to what's transpiring from a claims perspective with their plans. And so having data to guide us on that is most important, and most importantly, guide our clients, especially right now, is so helpful, as we're able to keep a close watch on the trend and subsequently have a little bit more of a baseline for our expectations for what, in advance of an insurance company sending a renewal to us on behalf of a client.
Got it. That's helpful. So I don't want to go down too much of a rabbit hole around self-insured
Sure.
here, but I think it's important maybe just spend a minute on it. And I would invite anybody listening. We did a webinar just specifically on self-insured and how that's no longer a thing just for big companies. It's certainly an option for probably much smaller companies than you might realize. So I'd encourage you to check it out. But what do you think the COVID impact specifically? So knowing that there's a lot of uncertainty how carriers are going to price 2021,
Mhm.
because we don't have all the data in yet, though we're getting there. There are just, like I said, firsthand experience. I know people who are going to save quite a bit of money because claims will be down. Any quick advice you might have for the audience around thinking about self-insurance?
Sure. I think, um, Of course, expectations and the concern around medical renewals from that financial perspective is absolutely forefront of mind, and understandably so. So regardless if your policy is self-insured or fully insured, there are, especially with the self-insured policies, the fact that there are less claims being paid, that is advantageous. But we do encourage our clients and all employers by example to think holistically in relation to their COVID-19 response when it comes to their business and employees. And what I mean by that is we currently as human beings right now are facing significant unknowns and uncontrollable variables, but what we can do and what we can control from an employee benefits perspective is how we can customize and design and implement changes into our strategic planning to ultimately acknowledge some of these different struggles that employees are facing and address solutions in the short term for sustaining health. And so not just that financial piece, of course, but the longevity of the emotional, physical, and mental health of employees as well. And of course, there's many Americans looking back to get to normalcy, me being one of them. And there are many afraid, to normalize too quickly or go into public. But we do strongly encourage ensuring that employees have the right resources and strategies in place to feel comfortable, to continue to move forward as they navigate the pandemic.
Yeah, very good. Okay. So to kind of to wrap this up before we start talking differences between Biden and Trump plans, safe to say that the carriers have some of the data is in
Hmm.
enough to have a pretty good picture of what they think 2021 will look like. We know that there's going to be a pent up demand issue. So they're going to have to anticipate extra costs just to recover from pent up demand. And kind of scary, there's maybe more of an unknown. I'm sure there's some actuaries in some dark corner that calculate all this stuff, but there's probably going to be some real cost for major claims for undiagnosed things in 2020 that are going to be therefore damned expensive to treat in
Hmm.
2021. Is that kind of a fair way to look at
It's a
this?
fair way to look at it. It's absolutely unknown, but as prepared as as an employer, as prepared as you can be, really kind of stems back to the things you can do right now in the short term to help get employees, more comfortable with utilizing virtual care or any kind of wellness initiative to potentially curb some of that unexpected cost. But yes, Mike, to your point, there's certainly a lot of unknown, and time will tell how it will unravel.
Yeah. Okay. So I think that's a pretty good backdrop to the question then, because this is not just a normal
Hmm.
healthcare renewal plan year. It's certainly not just a normal
Right.
election year. I think that's painfully obvious to everybody for a million reasons. But I think that's helpful background before we kind of jump into the campaigns now. All right. So I would say this is kind of, me and Nelly saying what we think the top five are. I think these are probably the biggies that are gonna, now when we say the top five, this may not be top five, what every American was gonna care about for their personal health, but when we think about small businesses and cost and how they take care of their employees, we think these are the top five for that. Would you agree with that, Nelly?
Agreed. Absolutely.
Yeah, so no political bias. This isn't, we're not forgetting any, trying to intentionally, setting aside any group or forgetting any group about, the impacts of healthcare, which for everyone by definition is very personal. We're seeing this through the lens of small business owners, entrepreneurs, executives from mid-sized companies, and how do we help them navigate? So,
Absolutely.
topic number one, how's each candidate going to address this whole issue of the public healthcare option?
Yep, that's a great one, and we'll just jump right in here and get started on this. So when we think about public health initiatives, it's important to consider what each candidate's stance is in this particular case and this election on COVID-19. And of course, the conceptual framework of a public option is critical to evaluate, and we'll get there and get to that in a moment. But beforehand, most pressing is really the response or pledged response, on each side as we continue to move forward and navigate the pandemic. And as we head into this upcoming election, as I mentioned earlier on, a massive component of our personal and professional lives is really rooted right now in this overall response as a nation, and it does have an impact on our well-being. So to take a little bit of a deep dive here, there are a few components specifically on the COVID-19 stance that I'd like to talk through before we jump into the overall public option. And so
Yeah.
when it comes to who is responsible really for managing the pandemic response, the Trump administration has delegated the primary responsibility of that to the states, with the federal government acting as a backup, whereas the Biden campaign, on the other hand, is delegating primary responsibility for COVID-19 response to the federal government. So a little bit of a different plan of attack there. And additionally, in thinking through emergency relief legislation, Trump did sign into action legislation which eliminated out-of-pocket costs for COVID-19 testing, for prevention, and then also for an eventual vaccine as well. And as part of this legislation, it also included the addition of paid sick and family and medical leave during the pandemic as well.
So
And on the
you're talking about what was in the FFCRA, is that? Yep.
correct.
Yep.
Yes. And then on the other side of that, the Biden campaign is pledging to expand additional COVID-19 relief, same regard as far of eliminating out-of-pocket costs for treatment, testing, vaccines, that kind of thing, as well as providing additional pay and PPE to essential workers, and also expanding unemployment insurance and sick and family leave as well. So in many ways, in regards to the legislation, they're both making similar pledges there in regards to what their response would be from a relief perspective. And another important component of this COVID-19 public response is specific to COBRA. And so for anyone unfamiliar, COBRA is an act that provides workers and dependents who lose benefits with the right to choose and continue group health benefits for a specific time frame and under certain circumstances. And the Trump administration, specific to COBRA, has extended the COBRA election period without any subsidies. And the Biden campaign is pledging to cover COBRA with premium subsidies during the pandemic. So in their own way, that COBRA has been addressed and loss of coverage has been addressed, which is something important to note. And so oh,
I,
I'm sorry, go ahead.
yeah, I got a question. I'm going to back up a little bit.
Sure.
So, as it relates to the public option, I mean, no surprise, Trump taking the more of a state-oriented approach versus Biden more of a federal-oriented approach. What might that actually mean to small businesses?
Sure. And so when we look at the public healthcare option and each of their stances here, this one's really clear cut. To your point, the Trump administration is not supporting a public option or Medicare for all, where the Biden campaign is pledging to establish a new federal public health option, something similar in nature to Medicare. And so as far as how this would impact small business owners and employers in general, this entire discussion on public healthcare options is really specific to anyone who's eligible for marketplace coverage and Medicaid, for example, Medicare, that type of demographic. But under Biden's proposal, anyone anyone who is eligible for employer coverage would have the capacity to potentially be integrated into the public option, which would be new. So that is something to consider from a small business and mid-market employer perspective, that would potentially change some from an administrative perspective, but ultimately from both of the public healthcare option debates between Trump's administration and Biden's campaign, not much substantially would change to impact the employer side.
Got it. That's helpful context. All right. And I think we're gonna take a deeper dive. I know this is an overlapping topic with
Sure.
ACA, but
Yes.
I think we're gonna wrap there because it's kind of the big deal, right?
Mhm. Absolutely.
So, yeah. Okay. All right. So question number two. Can you break down any specifics? So I know whether they're for or against ACA, and I think we all know what those high level positions are. What specific tactics is each camp proposing to just literally help cut some healthcare costs?
Sure, that's a great one, and it's certainly a topic of interest to so many at this point, as we can move towards the election. So the first piece to this that's really important to think about is in relation to disclosure of information and price transparency, because ultimately, as a healthcare consumer, we can only see the cost of care when it's disclosed. So the Trump administration is in the process of trying to require hospitals to disclose their standard negotiated charges so that consumers can shop for lower prices. And this is currently being challenged in court now. So there's no ruling on that. And conversely, the Biden campaign is pledging to enforce more legislation to prevent any kind of anti-competitive consolidations, and so that other practices that increase hospital and healthcare specific pricing would be kind of under that boat. And we'll get into prescription drugs. That's another real hot topic in a moment, but that's another piece of this, and it's important to note that when it comes to lowering costs and each candidate's ability and initiatives to really try to get there, the Trump administration, specific to cost, capped insulin costs under for some Part D Medicare enrollees, and the Biden campaign is in support of approaching lowering of drug costs through government negotiations and limitations on increases as well.
Very good. Anything else? Specific tactics?
Ultimately, those are some of the main key points of what they're doing to address overall cost as far as tangible items that the consumer would experience.
Yeah, I think they, for all the time, and I don't want to wade into dangerous political waters, but I think so much of the cost containment, bending the
Mhm.
cost curves, are more philosophical in the high level approach than
Sure.
in the actual tactics proposed, right? So
Yeah, absolutely.
okay, and that I really believe that on both sides. So
Mhm.
okay, here's a huge one, and I'm gonna teaser. I want to do a webinar just on this topic. The prescription drugs. Used to be that it was maybe 5-10% of the healthcare cost was RX, and increasingly that's coming a bigger and bigger part. Not going to be 20-30% of healthcare cost is now prescription drugs, especially when you get into specialty
Mhm.
drugs. So this is turning into really really big money that employers kind of didn't even have to used to think about. It is increasingly becoming its own thing, whether you want to carve it out as its own benefit to manage those costs separately, or just get transparency into what is a huge component of existing plans. Can you
Right.
can you talk about the differences in each candidate's plan when it comes to prescription drugs?
Absolutely. And this is a great transition, especially as we were just discussing cost transparency and really prescription drugs and all that has developed in the last couple years on this. It really impacts consumers on a personal level. And In a survey that was recently released by the Kaiser Family Foundation, which is fascinating, 3 in 10 Americans have stated that they're not able to take any medications as prescribed by their physician just due to the cost of them. And out of
Mm,
that survey, 19% admitted that even though they knew they needed a prescription, they tried to find an over the counter drug instead, since they couldn't afford it. And 12% were skipping doses or cutting pills, that kind of thing. And almost 30% didn't take anything because they couldn't afford to do it. And so, considering that, we know that it's something that significantly impacts consumerism, and it's a point of contention between all individuals, regardless of party and regardless of your opinion, either way, politically. So interestingly enough, the same survey polled Democrats, independents, and Republicans to determine their favorability related to the overall lowering of prescription drug costs. And in the survey, 84% of Republicans, 84% of independents, and then 94% of Democrats strongly agreed that it was important to allow the government to negotiate with drug companies in order to get lower and more affordable prices, whether that was Medicare or in the private sector. And so
wow.
from the data, we definitely see that this is an important conversation, and it doesn't matter, whether you're Republican or Democrat or you're anywhere in between, that it's important to everyone. And heading into the election, hearing, each candidate's side is really critical. And so, to address that, to date, the Trump administration has not yet released a proposal specific to whether or not the government will or should negotiate with drug companies to lower pricing. But what Trump did do is he did propose requiring drug prices to be included in TV ads, and that was struck down by the federal court. And the Biden campaign has proposed that the government should be responsible for negotiating with drug companies to lower the pricing, and ultimately would expect them to work in tandem to leverage lower pricing for Medicare as well.
Yeah, no, I'm curious. So I know that you're not a CEO of a pharmaceutical company, but you did sleep at a Holiday Inn Express last night. So how effective do you think? So if all sides want the government to negotiate better deals with pharma, how successful do you think that'll be?
It's a great question. I'm not sure, to be transparent on that. I think that ultimately it's it's a it's an extremely lucrative component of the entire industry. And of course, on our end, from my perspective, we work really directly with our vendors, and expect the lowest prices that we can get for our clients. But we don't, we're not in the details and ins and outs operationally there. So time will tell to see if any candidate is able to get any kind of legislation in place to help maintain and curb costs. And ultimately, although the costs, are high, and people feel that, there's still strategies and ways in which clients can approach the issue and determine cost-effective solutions for their employees based on, their demographic and what they're willing to offer. So it will definitely be an interesting point of the election to see how this plays out.
Yeah, no doubt. Insurance benefits, it's about risk pool, but a huge part of prescription drugs is buying power. So that'll be very, very interesting as
Mhm.
watch those two almost competing concepts intertwine. So, okay, let's jump to number 4. This is going to be a big deal, right? This pandemic, the old saying, I've said on this webinar series many times, we're all in the same storm, not in the same boat, necessarily in the same boat.
Mhm.
Um, the mental health issues that are
Yes.
we're already seeing are huge, and we have to assume 2020 we're going to see, I'd say, maybe the outcomes, right, of the
Mhm.
crisis that is already well underway. from a small business owner's perspective, and an insurance slash benefits perspective, first, I guess maybe frame up how you guys, the insurance industry sees this growing mental health crisis.
Sure. So mental health, I'm much like all of the other topics we've reviewed thus far. It's a significant point of concern right now amongst Americans as we continue to endure and push through the pandemic. There have been so many studies released on the effect of social distancing on mental health and working from home and how that plays into mental health. And if you're a parent, how working as a parent in a pandemic is extremely stressful and can impact mental health as well. Specific to legislation and how Trump and Biden have approached mental health, it's been interesting. And of course, we will definitely dig into the ACA momentarily here. So I won't go too in depth on that piece. But Trump's in support of repealing the ACA, which in turn reduces some coverage for mental health care services and would limit the scope of some equality rules and regulations. And the Biden campaign is pledging to enforce existing equality laws and expand more funding there. So that will certainly be a very interesting component to see play out as we move forward, because that's certainly a huge issue right now amongst healthcare consumers.
Nellie, can you put some more color around that? So what are the equality rules as it relates to mental health that that are at play here? What is it that be specific if you could about what kind of things could be covered, not covered, I guess.
Sure. And that's going to depend, Mike, honestly, on specific policies and then also if it's Medicare or not. But ultimately, just the ability to have mental health, first of all, acknowledged as being something that's deeming of any kind of insurance or healthcare coverage. I think that's the first piece of it, is that it's come a long way as far as acceptance and just acknowledgement in general. So that's a piece of it. But as far as the specific laws and funding there, both Trump and Biden, in their own way, are pledging to provide additional funding to help anyone, regardless of whether they are on Medicare or not, or in the public, private sector, whichever it may be. Like, for example, with veterans specifically, is one huge component of this topic that both campaigns have made pledges to continue to fund, and specifically in relation to veterans, suicide prevention and developing resources and specific expansion of those services for any isolated veterans. That's been a really critical component of some of the discussions to date, as far as from a legislative perspective, what each individual between Trump and Biden, between each of them, what they're doing. And so it's interesting to see that, for example, the Biden campaign is pledging to implement suicide prevention strategies, and write legislation in place to protect veterans and expand their services within the VA. And the Trump administration also is signing legislation during the pandemic to give funding and support to the VA as well. So it's that's one example of legislation that's related to making it fair for everyone to have this access. But ultimately, in relation to their decisions and moving forward for how they'll be covering this, that time will tell to see, depending on who's elected and where the preference goes there. But with the pandemic in play, it's a big issue.
Let's spend just another minute on mental health, because I think this is there's a change that's been going on for maybe a decade now, right? And tell me if I'm wrong, but as you consult with businesses in kind of putting together, benefit plans. Where
Sure.
does mental health fall into consideration from a benefit perspective, the perceived benefit, for recruiting and retaining and attracting talent, but then also from a cost mitigation on other aspects of plans. How have you seen mental health kind of evolve, if you will, maybe
Sure.
outside of COVID, outside of this election?
Sure, that's a great question. So, as far as mental health, mental health is a very expansive topic in that it manifests itself differently for different people in different ways at different times. And so, with some examples with our clients, something that at Assurance that we're really proud of and that we've done is we've put together, we have a very specific wellness team that works with employers one-on-one in managing and creating strategies and ensuring that whatever their targets related to wellness, and of course, mental health falls under that, of ensuring that their mental wellness and overall well-being is taken care of. We work with employers to develop those strategies. And something within that we're really proud of is we've put together a resource toolkit for our employers to provide to employees that is a toolkit for working parents in a pandemic that breaks down different resources, free webinars, and really anything you could think of related to ensuring that they have some support in the workplace as well as the help if they need it. So contacting an EAP or having a direct contact to talk to someone about anything they're experiencing, and really seeing that kind of development, whether related to the pandemic or not. Those are things that we see employers putting in place and having really, really successful long-term benefits from, since they are investing up front in their employees' well-being and providing employees with not only the knowledge that they're doing that, but then also the resources and the tools to help empower them in the workplace, and then also personally as well, because as you know, there's while you go to work and you work your normal 9 to 5 or whatever your hours are, you do take that home with you. And so it's simply not as clear cut as having them as separate entities. And so investing time in designing the right strategy for your employee demographic to ensure that you're putting in the front work initially to help them be successful in and out of work is really the most you can do to help mitigate this upfront.
Yeah, and I guess makes my 2 cents, and then we'll get off the soapbox and move on to the next topic. Would be, for small business owners and entrepreneurs, as you think about, and maybe even those, who have their employee counts are not yet to the point that they even are required to, and maybe they don't provide health benefits and rely on their employees getting it from employee spouses or family members or
Hmm.
public options. That it's only 6, 7 months ago that unemployment was all-time low. When a vaccine comes out, presumably we're going to be in a race back to that. And the war for talent was, and I would say, even though we're going through a crisis right now, still is very, very real.
Hmm.
And your most talented employees have choices, and they're going to seek out places that are the best for their families, right?
Right.
And I would say, rather than simply thinking about health insurance as a means for paying for medical bills, but
Hmm.
rather truly as a benefit that helps you to attract and retain talent.
Right.
Uh, I'd say, this is a conversation you need to be thinking about. So.
Absolutely.
Yeah. All right. Off my high horse on that topic. Let's talk about kind of the biggie. I'm assuming at 20,000 feet, anybody attending today kind of knows each candidate's position on this.
Hmm.
But break this down,
Absolutely.
because it's not just what stays or goes, but what gets built upon or taken away and what gets replaced
Right.
in place. That's the real issue here, right? So
Absolutely. Yeah, absolutely. And the ACA right now, again, whether you do or you don't like it, or you agree with it or you don't, it's a hot topic relating to the election. And as the litigation and conversations stirred up to overturn the ACA are set to begin November 10th, which will be right after the election. And to give some context on what is transpiring, just so everyone's on the same page, and as far as what we're hearing in the news and media, is California versus Texas. And initially, a coalition of Republican state attorneys general led by Texas argued that in February of 2018 that the Republican tax cut law of back in December of 2017 ultimately was rendering the ACA unconstitutional because of the reduction of the ACA's penalty to zero for not having any insurance. And so despite challenges historically that have transpired in the Supreme Court in 2012 and then again in 2015, this argument introduced in 2018 has gone through a series of appeals court panels, and most notably in New Orleans, it was agreed upon that without the penalty in place, the requirement through the ACA for uninsured to buy insurance is unconstitutional. And so on the other side of this argument, Democratic attorneys general who are defending the ACA have asked the Supreme Court to hear the case this year, as they want to speed up the process, and they're not looking to wait the months or years that any kind of reconsideration through the court system might take. And the reason ultimately that this is a critical part of the election is that with the passing of Justice Ginsburg and really at this point, no clear idea of whether a replacement will be coming or not at this time, there is uncertainty for whether it will wind up, for example, in a 4-4 voted tie, or if the seat will be replaced, there could be a 5-4 ruling against the law. The court could put off the arguments. Truly, at this point, it's kind of to be determined to see how that will shake out. But the part of this case that is really raising concern on any side, regardless of opinion and party, is that in surveys and data released on this, at least 20 million Americans are projected, and many more beyond when the data was released since the start of the pandemic, who rely on and buy insurance through that ACA marketplace, or might have Medicaid as well, could lose their coverage right away. And on top of that, millions more would also lose the law's protections that guarantee coverage for people with any pre-existing health conditions. And that includes people who might have had COVID-19 as well. And so if it were to be overturned without any replacement of new legislation, and this is not a comprehensive list, just a few things that would right off the bat impact the population, is that, for example, adult children under 26 wouldn't be guaranteed necessarily the right to remain on a parent's plan. Medicare patients would have a loss of additional prescription drug coverage. And another example is women would lose guaranteed access as well to birth control, and that no out-of-pocket cost feature there as well. And again, regardless if anyone does or doesn't support the law, or if you agree or you don't, it's just important to note that with the ACA and this case, any kind of sudden elimination without a replacement wouldn't just impact any patients and the general consumers. It also has a pretty substantial impact on insurance companies, hospitals, drug companies, even doctors. All of these entities follow coding and generalized business operations based on the ACA's incentives and penalties built into the law. So without any real safeguard, if you know, so to speak, in place, then these overall rules that regulate billing and payments would be wiped out, and that does pose a potential for threat of having any kind of tumultuous experience across the board. And again, of course, this is assuming there was no legislative fix put in place to curb that impact.
Yeah.
With that.
It's been off the air for maybe a couple of years, but the Netflix show House of Cards, it was a junkie
Yes.
about. I mean, this is like they
Right.
couldn't dream up a scenario like this. This is
Right.
crazy, right?
Right.
So I mean, this is not scientific. This is just kind of my gut that, I think most people are, vote healthcare based on their conscience, whether they're free market oriented, whether they're uh, uh, government needs to create the safety net and protect people have their whatever their orientation. And I think they vote probably their beliefs more than their wallet when it comes to their business. But that said, how specifically do you think this will play out? The impacts will play out positively, negatively, and without trying to take sides here.
Sure.
On this, I'm curious more about the small business impact, right?
Sure. So interesting. I mean, interestingly enough, if Biden were to get elected, like as a just a hypothetical, he can't drop the lawsuit because the Trump administration is not the plaintiff, and so the GOP attorneys general is in this case. But in the event that a Democratic Congress and a Democratic president were in place, they could, in theory, they could make changes to reinstate the penalty, for example, for failure to have insurance. Even if it was a minimal penalty, they could put something like that in place, which would make this issue temporarily go away in the short term. So that's one example of a way in which it could play out, and kind of how then that would trickle down and impact an employer. But ultimately, really, it will depend on whether or not, first of all, that the hearings, that does take place. That'll be the first piece. And the second will be whether or not, from a Supreme Court perspective, they have seats filled or not. There's many variables that play into this here, but as far as immediate impact and immediate of what we'd expect to see, if Trump remains in office, then assumedly we'd move forward with the process that's been established there by his party, and also with his administration. And if Biden were to be elected, then there would be decisions on that end that they'd make together with Congress. So time will certainly tell.
It will. And maybe the last thing, because this is the last topic we're going to go through with, but I'm curious, how do you think this all works? So there's obviously an election in November. Regardless of the results of the election, if there is a change in administration, that doesn't happen until late January. We're well into, for a lot of people, we're well into renewal season right now. How do you how should we be thinking about timing of not just election, but inauguration versus open enrollment season in renewals? Are we really talking about 2022 here, or do you think this is going to really still fundamentally change 2021?
That's a great question. And if we've learned anything from 2020, it's we have no idea what's coming next when it comes to healthcare, and just in general, with everything moving forward. But from what we see, and from on our end, election aside, just looking at the pandemic and premiums, what we expect to see is as we discussed in the beginning of our call here today, that we do expect to see some kind of increase at some point down the line. Again, it will completely depend on each individual insurance company, and then also claims data and experience on an employer level. And the best thing, and really truly the one recommendation across the board, is just to continue to plan and prepare and put infrastructures in place at the employer level to ensure that employees have the resources that they need and they feel comfortable moving forward in the pandemic, with what they do have access to from a workplace perspective.
Yeah, very good. So there's a whole heck of a lot we don't know. We know that the pandemic and the shutdowns have kind of decreased services here in 2020. There's a fear that that's created A, pent up demand, and B, some undiagnosed health issues that are going to be now diagnosed when they're at a more advanced stage, which could certainly have a negative impact on premiums and costs for small businesses. And beyond that, there's just tons of uncertainty with this election in the Supreme Court in it's going to be interesting to watch this next, 3 months unfold.
Absolutely. Absolutely.
Yeah. Well, Nellie, as it doesn't unfold, I will be sure to have you back, and we can kind of unpack what happened.
I would be happy to join once we get more answers here.
Well, I know I got smarter on benefits and health insurance today, and I hope our audience did too. I want to thank you very much, Nellie, for joining us today.
Absolutely. Thanks for having
For
me.
all you guys on today's call, you can find a recording of this webinar on our website at assuresoftware.com /COVID-19, where we have all of our COVID resources, webinars like this one, ebooks on reopening your business, step-by-step instructions and guides for PPP loan forgiveness, including the complex one and the easy forgiveness applications, and tons more resources. So hop on the website. Hopefully you find the resources that are valuable, including registration for upcoming topics. Next week's topic is multi-state taxation. A lot of companies, small businesses who you might not think, it might not even enter your consciousness to be thinking about multi-state taxes, because all your employees come into your office. Let's say you got 25 employees, they come into your office and you tax where the work is done, and so whatever your local tax rate is. But if you happen to live, say in St. Louis where I do, and your office is St. Louis, but you got some employees coming across the Mississippi River in Western Illinois, and now they're working from home. If you've changed your work policies due to COVID to be work from home, you got to be asking yourself, are you withholding the proper taxes from your employees? And there's employers are going to get stuck on this. So this is a real wonky policy specific kind of payroll techie issue. But it's one that I think a lot of people are going to get caught flat-footed on. So that'll be next week's topic. We got some real experts to unpack that. And with that, just a reminder: Assure Human Capital Management, 4 core products: payroll and tax, time and attendance, HR software, and HR services. Here to help small businesses grow. But I'd say in 2020, it's to help you get your head around all these changes, stay compliant with all those new complex laws, and survive 2020. So when we get out of this thing, we can get back to growth. Nellie, I want to thank you so much for your time, and I want to thank everybody for joining us today, and wish everybody a great day.
Thank you.